So welcome, ladies and gentlemen. Thank you for joining us here for the Rural FASD Support Network Speaker Series. We are thrilled to have Lisa Longworth of the Ontario Provincial Police join us here today. She is one of the key architects and as knowledgeable a person as I know regarding the mobile crisis response teams that we have been hearing a lot about that the OPP have been implementing across the province. And we, first of all, also need to thank our guests. We have the largest studio audience that we've ever seen. And within our studio audience today, we have several members of our provincial parliament here with us today. We have members of the Ministry of Solicitor General with us today. We have members of the Department of Justice Canada with us today. We have several service providers and FASD workers from across the province, as well as many, many caregivers raising children with FASD, and in fact, even a couple adults with FASD here today. The last group that I want to acknowledge, though, is we're particularly thrilled to have a couple Indigenous partners from up north with us. This is really exciting, and we're really happy for you to be able to join us as well. We want to also acknowledge that we are on the traditional and ancestral lands of our wonderful Indigenous partners, of which we come in a spirit of unity and collaboration to work, play, and pray. And so as a little bit of background as to how this presentation came about, Lisa and myself and our group first became introduced to each other back last February when we had the pleasure of doing a presentation for the Legislative Assembly at Queen's Park. And within that presentation, we heard information from Lisa that we had never heard before and found extremely exciting. And so it was at that time that we had came to an agreement that she would redo that presentation for us. Of course, the world turned upside down on us a little bit, which is why we're now, I guess, 11 months after the fact, but we are beyond thrilled to have Lisa join us. So at this point, I will turn it over to you.
Thanks so much for having me this morning. It's especially nice because it's a Saturday and I don't have appointments backing up to this, so we can, within the Zoom call at least take our time. It was a real pleasure for me to meet some of you back in February at Queen's Park. And just for some context, I've worked across sectors in human services with children and youth and in primary care, mental health and addictions for, again, I already admitted I know about Romper Room. So it's going on 28 years at this point. And on this journey, I have always been a strong advocate for individuals living with neurodevelopmental disabilities such as FASD. I'm always learning from my colleague and friend who's the Sunbeam Ontario FASD coordinator out in Waterloo Region. And actually, my partner, who's a Waterloo Regional Police Officer, and I have both been volunteers for the Reach For It program in Kitchener-Waterloo. I know most of you are probably familiar with Lisa Holmes and that program. For those of you in the audience here as parents and parent advocates, I can confirm that downstairs at this very moment are 3 of our 5 children, along with the dog and the 8 chickens outside, of course, one of whom has special needs as well. The kid, not the chickens. So, this work is very near and dear to my heart. It's why my kids, my family is why I've chosen the profession I have. So that's a bit about me personally. Professionally, I came to the OPP, and for those of you who work in social services, I wasn't always a big, sometimes I pushed back on the police a little in advocating for my clients. So the thought, if you'd asked me 20 years ago if I'd ever see myself working for the police, I would have said, no way. But I came over here about 3.5 years ago, and it was supposed to just be a contract position to help roll out some mental health strategy stuff they had going on. And they saw the value of having someone from the healthcare field help with that. And I thought, wow, that's a real shift in policing. And so I thought, what the heck? So here I've stayed, and I couldn't love my work more. My role with the OPP is in our community safety services. Normally that job is out of Orillia, which is where our headquarters are, but I live in rural Oxford County, so I actually work out of a detachment here, but more recently my home. And I am the provincial mental health lead to support our work and partnerships across Ontario involving mental health and addictions. So today I'm sharing a bit about one of my several portfolios in that role, and that's specifically about mobile crisis response teams. So I know that Rob may want to share some of his own thoughts and experiences in your community related to the Lanark County OPP MCERT if we have time at the end, but that was one of the catalysts, I think, for us coming together at Queen's Park. So today I'm going to share with you a little bit of specifically about the evolution and general understanding of mobile crisis response teams, like really high level, give you a little bit of a provincial overview of what's going on, and then the OPP specific landscape, and then, you know, a little bit about your own community, some of which you may or may not know. So, so what are we talking about? We're just for clarification, it's just to understand that indeed you are in the right virtual room this morning. We're here today to talk about the general purpose and of mobile crisis response teams. So those are mobile crisis response teams, or what I'll call them MCERTs throughout the presentation typically. But these involve police officers and mental health and addiction service providers responding together to mental health and or addiction related crisis situations where police have been called to respond. Okay, so we know that sometimes the police are by default our crisis go-to, right? So, and sometimes that includes a crisis where people are having a difficult time coping. So we want to engage our health partners, recognizing that police are not experts in that field of practice. So it's the goal of the OPP and many police services across Ontario to engage in that collaboration. So these teams help to de-escalate crisis situations at the scene. They also help to divert individuals from what can be a very traumatic, costly, and often unnecessary hospital emergency department visit and or unnecessary criminal justice system involvement. Right? We don't want to be perpetuating the criminalization of mental health or substance misuse. And we support individuals by connecting them to local services in their community for longer term support. Now, I just want to clarify as we move forward that police have limited capacity within their records management system to identify situations. So, for example, if you've ever watched an episode of Brooklyn Nine-Nine or 100 with your teenager, or a Law and Order episode in the 90s, you've heard something like, we have a 1019 in progress. So I tell you this fun fact because you will note that I say mental health crisis or mental health throughout the presentation. And I've been challenged by my colleague at Sunbeam about, you know, FASD, for example, is a neurodevelopmental disability. It's not a mental illness. And she and I are in agreement upon that. The thing is that within that limited system, the OPP only have a code for mental health, right? So that's how police across Ontario and nationally code things within that limited system. So both myself and our OPP members understand that crisis is a state of emotional distress where any person, including you or I, is having difficulty coping. And this distress can be brought on by any number of things such as, but not limited to, trauma, substance use, grief, loss, and triggers related to a disability. But I only have 30 minutes, so I just want, and that's a bit of a mouthful, so I'm just gonna carry on using the language that we use in policing. So a little bit about the history. Certainly there's always existed the option for police to contact or connect with healthcare partners informally. However, over time, privacy legislation has and should restrict information sharing in informal relationships to protect human rights. And the ability, and the other implication or impact has historically been that collaboration, often in an informal way, relied on the ability or willingness for police to reach out to the health partner, if they even had a relationship. And it often depended whether the relationship on any given day or at any given time was a positive one, where they felt they could connect. But then about 20 years ago, police and healthcare began collaborating in a more meaningful way in their joint responses. We saw, for example, the Hamilton Coast model emerge, and that the catalyst for that, sadly, was a very significant death of a child in the Hamilton area. And we also saw the emergence of the Toronto Mobile Crisis Intervention Team rollout. So many of these started out as more follow-up type models, and we'll talk about type of models shortly, but they were definitely pioneers in the work. And like all of us, they've continued to evolve. And for example, the Hamilton Coast model was really one of the first to evolve and expand to add more of an on-site, in-the-moment mobile crisis response team to attend live calls with police. And on the flip side, the Toronto team, for example, like many of us, their model looks to, both Hamilton and Toronto look to the crisis intervention teams model in the United States. That's where they're largely focused. And they've kind of built their name in Toronto around that. So theirs is called, their team's called the Toronto Mobile Crisis Intervention Team. We'll talk about names of teams in a moment too. So those teams just continue to expand. So in 2019, from a really high level perspective, in 2019, the OPP was a catalyst in bringing together a provincial working group with some really great partners in the province, CMHA Ontario, our ministries, other police services, our health providers, our LINs, to look at models and how they were really evolving in Ontario. Because what I noticed when I came on board with the OPP was there were all these great models across Ontario within the OPP and outside of the OPP, but everybody was working in isolation, and that's never a really solid long-term plan. We're better together, right? So I kind of invited folks to come together, and we actually started a provincial working group, and we've been going since late 2019. And we engaged in an environmental scan to start. So we received 83 responses, which provided information on approximately 40 distinct MCERT teams. Now, I'm a social worker and we don't do math for the social workers online. But even I know these numbers don't match, because 17 teams were identified as in development or duplicating, or did not meet the survey definition of MCERT. And of course, the remaining numbers come from the stragglers that didn't even complete the survey. So there's always a few of those. So you can see here in this graph what I was talking about, that evolution, right? So you can see back in 1995, 2000, and so on, there was just sort of that slight build of the follow-up kind of coast models, and then wham, in about just before around 2015, they just started to take off. And you know, we've seen that significant shift in the last 5 years. And that is the development of the more mobile crisis response teams on live calls. So let's take, this is a bit of a visual, if you will, about the types of models that have emerged in Ontario. So for those of you who are like myself and my son and we like to visuals, this might help. But within the OPP, and really provincially from a ministry perspective, and our provincial working group, we're using this same language. So I can tell you within the OPP, we have different terms. So dedicated, embedded, live, follow-up, ride-along. And we ask our detachments that are building a team to draw from those definitions to qualify their team, or to name it, or give it a type. So we have dedicated teams where the detachment has the resources to dedicate an officer to the team, and that's their full-time gig. We have embedded, where the crisis worker kind of lives at the detachment, or that's where their office is, maybe in with the constables or in a little office off to the side. Live means that the teams attend live police calls for service that are coming into police real time. Follow up means the team also or only attends to provide follow-up services after a call, police call. So maybe at 3 in the morning, the crisis worker, that's not when their shift is, because they're not all funded 24/7. And the police officer does a referral and says, hey, I didn't apprehend this person, they didn't meet the criteria, but they're really having a tough time and they said they'd love to connect with you. Can you go out or contact them today? So that might be a follow-up. They may also go with an officer to do a wellness check on someone. So that's an example of that. Ride along refers to how they get there. So ride along models would be crisis worker traveling with an officer in a police vehicle. And then co-response means crisis worker travels in their own vehicle and meets the police at the scene. So we asked folks to kind of pull from that to explain what their team looks like. So this just gives you a bit of a visual on that. And so we've talked about the type of team, but then a lot of questions come with, well, who's on the team, right? Obviously, there's police officers on the team, really awesome ones. And again, when we look to the 2019 results, and I honestly don't think these have changed too much as far as the type of mental health worker, you can see that some teams utilize social workers. So for example, in Ontario's OPP West region, which is Southwestern Ontario, I find that those teams typically have social workers. However, out in the East, where many of you are today, I find that they tend to use registered nurses. And there's no one is better than the other. I mean, anybody who's worked in the field long enough or has a kid who's seen a professional, it's whether they're good at their job or not, and you know, are qualified to provide crisis support services and crisis intervention. So certainly we have you know, criteria for our teams, but there are also, you'll see there's a really high number of what we say variety, which is registered and unregistered professionals. And that's due to a couple of reasons. Like there are other professions that might work well. So for example, at the Hamilton Coast model, one of the amazing pioneers in this work, she was a registered occupational therapist that had always worked in mental health. And she is just the guru, right? So, and then we have other communities where there might not be a really rich population of registered health professionals, so they may be unregistered. And then as we move into our northern, more rural communities or remote communities, we may even see elders who are part of the team, or healers. So that's who might fit into that variety piece. Now, as for the police graph, I can proudly say that this table has likely tipped, or I would like to see a new one come out in the near future, because when this scan was done, it's hard when you do a survey with the OPP, because we have so many detachments. So it might go to the organization, but it may not always expand to the rest of the detachment. So to be honest, as an OPP member supporting this work, I make it a point to encourage collaboration between the municipal and police partners as much as possible. So for example, in Lanark County OPP, you work with Smith Falls Police Service. I'm sitting in Oxford County today, and Woodstock Police Service and the Oxford OPP have an agreement with their Canadian Mental Health Association. And ultimately, again, that's because we're better together, and this practice ensures seamless and equitable services across the county or region. And people will just know, right? Oh, that same service exists for both, right? The community is able to better understand it. So we look at naming conventions as well as part of the teams, and this is where it can get a little fuzzy. So you'll see what I mean when I say I noticed everybody was doing it very, very differently. And while, again, I've admitted I'm a social worker, we don't do math, I have come to realize after 28 years in the field that data collection and evaluation, using those numbers and looking at things from that broader perspective, really helps to ensure that we're doing a good job, right? Is this just, we can't evaluate it if we don't know, if we can't collect the information. So the OPP continues to try and move towards some naming standards, but let me be honest, everyone likes to put their own flair on things. So as much as I can suggest, or the Ministry of Health or the Minister or Solicitor General can suggest that we'd like to see, everyone call them, a mental health, a mobile crisis response team. I can totally empathize with the desire to have your own flair on it. So we do see different team names across Ontario, be it in the OPP or municipal police services. So for example, MCIT is a mobile crisis intervention team, MCIRT is mobile crisis response team, we have MCERT, which is mobile crisis rapid response team, we have mental health response units, we have mental health engagement and response teams, we have impact team in Wellington County. So everybody, and some of those predate this new work happening provincially, so that explains that. But what we've done within the OPP is we have, we recognize that it's really important to compare apples to apples rather than apples to elephants. And so the OPP continues to enhance our data collection through our niche records management system for consistent tracking templates, and with consistent data tracking templates and core components of the teams. We may have different forward-facing names to reflect the desire of the community partnership. But in the fall of 2020, the OPP designed a process within our niche records management system to allow us to capture all the teams as MCERT is the assisting officer, to better evaluate our utilization of the teams and the outcomes and the work they're doing towards evidence-based practice. We're also now in the process of our first provincial OPP MCERT evaluation strategy, and we'll be facilitating this in the spring of 2021. And I'm thrilled to have the Lanark County OPP participating in this plan. So we have our first working group meeting next week. And I'm sure they're dreading it because I'm a bit of a taskmaster. So the other piece that actually isn't on the slide, but I want to speak to is the partnerships. So MCERT teams also vary in regards to the type of partner they may collaborate with. Some teams may only involve OPP and a health partner. However, whenever possible, we try to engage the municipal police and the First Nations police in those. So for example, up in Manitoulin Island, if you're calling in from there, or Little Current, somewhere up there, they've engaged their First Nations police as well as the OPP detachment there. Where you are in Lanark County right now, they've got the municipal police, OPP, and mental health, or Lanark County Mental Health. MCERT teams may be developed with a community health provider such as KFLA Mental Health or Canadian Mental Health Association branch, or with a hospital, such as the Cornwall and SDG team. But regardless of the choice, you're ultimately better together. So regardless of what team or what health partner the police are working with, we always try and help or encourage them to engage the hospital as well, because it can help ease the transition when a police hospital transition does need to take place. And speaking of, sort of that teamwork and partnership, the OPP has been co-chairing the provincial working group that I mentioned to bring all of us together: healthcare, community health, municipal, and provincial police in our ministries. So we work with CMHA Ontario to co-chair that group to support information sharing about MCERT practices and common approaches to the work. So I have been lucky enough to co-chair that work with CMHA Ontario, and we have been developing a toolkit and framework for MCERT, but unfortunately it's been delayed due to COVID-19. So we'll look forward to that in 2021. So if we drill it down a little bit to the OPP perspective, and compare, if you remember, if we compare those early on 2019 survey results from the environmental scan completed in 2019, you recall that there were about 83 responses in total, some of which weren't valid. So there were 40 distinct teams at that time that were identified through the survey. The number you see here on the slide which reflects the end of December 2020, shows that the OPP alone, so these are just now OPP numbers, we have approximately 62 MCERT teams in Ontario that have either implemented or are in various stages of development. And in a moment, I'm going to share a little map to show you that for those who prefer things mapped out and visual like I do. Many of our teams are collaborative, or a collaboration between our OPP detachments, municipal police, and their counterpart with health. And I've mentioned the Lanark team today. We work very hard to also engage our hospitals, as I said, because to ensure they're part of the team, so that when individuals in crisis do need to be apprehended by police and go to hospital, I mean, that can be a very, very traumatic experience. You're already in crisis, and now you're being taken by police to the hospital, and all that happens there. So, I mean, really, really traumatic. Honestly, I used to find it traumatic taking my kid with an earache to the ED, but so I can't imagine, right? So we're all working together, and the MCERT worker can have health information to health information, or healthcare worker to healthcare worker conversation during that transition, which can really ease it for people. And it can often get our police back out into the community to do policing. Our OPP Community Safety Services team provide our detachment with comprehensive resources to ensure success. So we provide we have a standardized memorandum of agreement or understanding template, data collection templates, orientation and training outlines, process guides for development and checklists. And we also provide two of me. So myself and my counterpart in the north are considered the provincial mental health leads or subject matter experts that come from mental health and addictions healthcare field to provide support, in-person collaboration and engagement, expertise and assistance through challenges faced. And I'm going to say that as a former healthcare worker, again, who wasn't always a huge fan of the police, back in my early days in the field, I am inspired and impressed daily by the dedication of our OPP leadership in regards to supporting individuals who are experiencing mental health and addiction-related challenges. You know, we're having great conversations in policing now about harm reduction and changing language, and the engagement they have and the drive and commitment to support these teams is incredible. In fact, our newest pilot project, which is an extension of MCERT, involves crisis call diversion, where we have embedded a crisis worker from a community mental health into one of our provincial communication centers with call takers. But that's a presentation for another day. So, so I'm going to just do my best and hope it doesn't mess up on me to give you a map. So I'm going to just show you a map. So when I talk about the teams in Ontario, you're going to see here, this is our Northwest. So the little green dots represent implemented teams. They're active right now as we speak. The yellow dots are developing or near implementation. So they're actively developing and near implementation. And then, and when I say near implementation, like this quarter or next quarter. And then the blue dots are what I would call collaborative response models. So there's a picture. And collaborative response models occur due to geography and or a lack of community resources or funding, where a community may not have the capacity to implement a formal mobile crisis response team and will instead develop a model for police to connect individuals in crisis through referral or consultation with community mental health or addiction partners. So that's just a little quick hit view of the province. So while you maybe end up watching this presentation from anywhere in Ontario, today I'm chatting with you, the fine folk, well, I'm chatting with you from rural Oxford County in southwestern Ontario, and I'm chatting with the fine folks of our OPP East region, located in east of the Greater Toronto area, all the way over to the Quebec border. And I know we have folks joining from all regions of Ontario. To those who have organized today in the East, I love visiting this region, and I missed it during the pandemic because the scenery is so beautiful. I always like stopping at the Big Apple and shopping in downtown Perth, but in that region specifically, so to speak to the region that organized today, so in our East region, There are currently 11 mobile crisis response teams already up and running to support individuals across the lifespan when they experience a crisis. Another 4 teams are in various stages of development. And these folks, I can't say enough about them. They do incredible work. They follow up and check on the wellness when someone's having a tough time. They're supporting individuals who are in need of mental health services at a local hospital. They connect people to local services that will help improve their quality of life. They listen. They walk folks through crisis situations to calm things down, de-escalate, and look to linking them to long-term help and reduce future calls for police intervention. And they touch base with precariously housed individuals or persons in need of addiction supports, just to list a few of their daily activities like that. That could be just a morning for these fine folks. The OPP could not do this work without the equal partnerships of our incredible health partners. And there are just way too many. I have about 2 minutes left here, and there's way too many of those amazing partners to mention today, both provincially or regionally. But just in the community who invited me to speak today, you know, I can say we're so grateful for the service partnerships with Lanark County Mental Health and Addictions and Mental Health and Addiction Services, KFLA. And actually in this, one of these photos here, you can see, you get a glimpse of the mental health nurse Dawn DePrado from our Cornwall Community Hospital, and our acting Sergeant Jim Blanchett from Stormont, Dundas and Glengarry Detachment going out on one of their first calls. I also know we have our detached commander from Lanark County OPP Detachment with us in the audience today, and I'm never disappointed in his ongoing dedication to the success of the Lanark MCERT to support his community and the great collaboration between the Smiths Falls Police and Health Partnership there. To my earlier point to leadership support from the OPP, I think that some of those OPP leaders, some other OPP members and leaders are on the phone today with their coffee, but Scout's honor, I actually wrote these notes before I knew they were joining us. So anyway, that's really the overview of the work that we're doing provincially and within the OPP. I'm happy to take questions depending on the time, but I want to thank Rob for inviting me today and for each of you for your attention on a Saturday morning. My goodness. My hat goes off to you for taking time this morning to be with us, whether you're a health professional who supports the day-to-day work, a police officer committed to the much needed change in how we deal with mental health, a politician maybe supporting your constituents here today, or whether you're a parent with special needs, because I honestly can say from experience that my kids are truly the reason I have always chosen to do this work. And I know that we're all making a difference. And on behalf of the OPP, we are here, we are listening, and we are committed to keeping you and your loved ones safe and well. So I hope you enjoy the rest of the day, and that we have a chance to talk again sometime. Thanks, Rob.
Thank you very much, Lisa, for this. I guess as I was listening to this presentation and thinking about some of the things that you have presented here, I think the two that really jump out at me, number one is you're absolutely right. When I think about everything that Inspector Karuna has done with here at our Lanark OPP detachment, when I think of what Chief Mark McGilvery has done with the Smith Falls Police, and then Rebecca Fromowitz as well, and all the work that they've done there, it reminds me of the fact that when our organization started 2.5 years ago, and it was just the 6 of us gathered around, we really identified there were 3 key community partners that we knew that we had to work with. And it was really based around the fact that we know from the research done by CanFASD that people with FASD, we know that 90% of them who are not currently supported are going to have mental health challenges. And so we knew that we had to really connect well with our local mental health organizations. And when I think about Open Doors and Children's Mental Health, of Leeds Grenville Children's Mental Health, and then Rebecca, of course, they have been a wonderful partner with us right from day one. But the other partner that we knew that we had to tap into was, we also know that 75% of unsupported adults with FASD are going to come into contact with police, whether that's from a perpetrator standpoint or a victim standpoint. And so we knew that was the second partner that we absolutely wanted to make sure that we were connected with. We have certainly seen just changes in life trajectories for some of our members because of the work that our local police force have done, and recognizing that, okay, there was something wrong here, and being able to direct them to the supports and the paths that were needed was absolutely the key. And so we've been so appreciative of the training that and the focus that that they have had, and wanting to know how to help people with FASD as well. And your presentation really speaks to that. I guess the last one that I would also want to mention, I know the last time we had spoke back in February, I was mentioning to you that we were aware that our federal organization, CanFAS, was in the process of developing an online course to kind of educate solicitor general professionals as well as justice professionals. That online course is now completed and available, and I wanted to make sure that our audience was aware of that as well. Unfortunately, right now, we don't have an organization in Ontario that has a membership with CanFAS, so it is available from an individual license fee, but certainly that would be a collaboration that we would love to see going forward as well.